Mass incarceration in America is a chronic issue that affects most Americans, even those who don't realize it. Although many don't personally know someone in prison, the grandiose scale of the American prison system affects the entire society it resides in. According to the U.S. Bureau of Justice Statistics, 2,222,300 adults were incarcerated in U.S. federal and state prisons and county jails in 2013. That is 1 in every 110 U.S. adults in the U.S. resident population. According to PrisonPolicy.org, the American criminal justice system holds more than 2 million inmates in 1,719 state prisons, 102 federal prisons, 942 juvenile correctional facilities, 3,283 local jails, and 79 Indian county jails, as well as military prisons, immigration detention facilities, and civil commitment centers, and prisons all across the U.S. A prison system of this scale comes with a plethora of unique challenges and concerns, foremost of which being providing quality health care to those serving sentences. My name is Layla Udetta, and as a first-year public health major at Elon University, I've done extensive research to determine the most effective ways to deliver quality carceral health care to inmates. Mass incarceration is an issue that affects the U.S. unlike any other country. America constitutes 4% of the world's population, but 25% of the world's prison population. Because of the sheer number of inmates present, prisons struggle to provide quality health care to each individual. Healthcare is also compromised through the dual loyalty providers have to patients and their correctional officers. Caregivers are often obligated to share health records of their patients with correctional healthcare officers who may utilize that information to enact punishment. This leads to inmates often lying to their healthcare providers about things such as drug usage and sexual activity, compromising their healthcare. Additionally, many prisoners lack the rights and resources to advocate for themselves, furthering the issue. Furthermore, the issue disproportionately affects society's most vulnerable population, poor communities of color. According to a report published by the Sentencing Project, 1 in 3 black men born today will go to prison in their lifetime. I propose 3 feasible solutions to improve carceral health care. Firstly, increased incarceration screening for diseases such as HIV and TB to improve treatment of these diseases, as well as to ensure that they are not being brought back into communities. Secondly, separation of medical and penal reports in order to improve caregiver-patient relations. Finally, patients' re-entry and rehabilitation programs that are essential to ensure inmates who have just been released maintain quality healthcare practices. These solutions should be implemented and funded by a collaboration between public health nonprofits and federal facilities. Many would argue that if one chooses to commit a crime, he or she should suffer the full extent of the consequences. However, since 95% of inmates return to their communities, this issue pertains to those innocent of a crime, as poor correctional health care leads to poor community health care. Furthermore, the Supreme Court mandated that correctional health care is a constitutional right in the 1976 court case, Estelle v. Gamble, and therefore we need to be ensuring that prisoners reap the full benefit of the law. Ultimately, convicts are still humans that deserve humane treatment and the right to a certain quality of life. There are several actions you can take to change the current state of correctional health care. Use the hashtag correctional healthcare to increase awareness about improving health care for these inmates. Additionally, contact your senator or state representative about implementing statewide correctional health care reforms at www.yoursenatorslastname.senate.gov. And remember, carceral healthcare is community healthcare.